medical doctor from Basildon University Teaching Hospital, Dr. Femi Oyekan, joins us from London via Skype. Thank you for joining us on TVC News at 10. Well, what is your reaction to this move by the federal government for life and health insurance for these frontline workers?
Thank you for getting me in. I'll say to a very large extent, it is a welcome development. And I don't think that it should be, I strongly think that it shouldn't be limited to just health workers, and it shouldn't be limited to when there is crisis. There should have been a comprehensive package for every citizen of Nigeria, so that in a situation like this, the panic package will not be what people will be looking up to. Because if you look at Nigeria, if you look at what has been happening about a few days ago, where I think Lagos was Lagos came up with this method of trying to help some of its citizens with food and all of that. The way it was distributed, even this distancing that was recommended by WHO, or even the isolation was totally not observed. So you'll be wondering what's the rationale behind trying to come up with a package that you don't have a concrete plan to execute it. So
Dr. Oyekan, could you do us the honor of helping us understand how this operates in some other parts of the world? You're in London, for instance. How does it operate there?
To a very large extent, here, before even you go to see a patient, you have something like what we call an MDU, medical indemnity organizations, that protect your rights on how you operate, possibility of maybe you might be exposed to infection, and there are also social security packages that protects people, that give you like what we call stimulus in case you are fault, or maybe you expose yourself to injury. There are other packages that will ensure that if anything happens to you, you are covered and your family is not affected. But I don't think we have something like that in Nigeria. If that's what the president is trying to introduce, it's a welcome development.
And significantly, even before this announcement, the World Health Organization, for instance, has commended Nigerians at different times for how it has been handling the pandemic. So what improvement do you see this bring to the table?
Well, to a very large extent, this is my personal notion that Nigeria, in a way, Africa at large, stands at an advantageous point in this pandemic, being that we were not the first to experience it. So we've seen the way China, we've seen the way UK, America, Italy, Spain are responding to it before it started coming to Africa. So in a way, it gives us an edge in such a way that it gives us the opportunity to think, the opportunity to see how the world, how this has affected global trend, economy, business, and health. So I think that if this eventually becomes a disaster, it will be a big shame to the government and to the people managing the affairs in Nigeria.
Only hope that it doesn't get there. Dr. Femi Oyekan is a medical doctor from Basildon University Teaching Hospital, London. Thank you for talking to us.